Let me ask you a little trivia question, if you don't mind. What do the World Health Organization, the National Institute of Health, what does every single nursing association and state nursing board and every single nursing class and every single nursing college, what do every single medical school, every single medical book on infections, what do these hundreds and hundreds of health-related entities have in common? The list does not stop there. Every single county health department on the planet, that's a lot of departments, it's a lot of people. What do they have in common with the other entities? And the correct answer is, surely they're all health related, but what they have in common is they all have written literature, black and white in writing literature that states one thing, that they all state, and it's almost quoted word for word between every single one of these entities. And that is this. It is written. Hand contact is the #1 form of disease transmission. Yeah, there's diseases that are not hand transmittable, bloodborne pathogens. That list is so short, and you wonder how, in fact, these people that are running the show fail to tell you, fail to identify, fail to emphasize, fail to even educate that which they have in their own handbooks, their own textbooks, their own memos, and their own literature. And we see many times people, oh yeah, wash your hands frequently. Well, what does that mean? What the heck does that mean? Wash your hand. Is it every 30 seconds? What? And we're seeing now that alcohol actually makes a better hand sterilizer than anything with bleach in it, because it's a solvent and it breaks down the crowns and the proteins that this virus has, and almost all viruses. Yet, wash hands frequently is as close to admission that you're ever going to get. And why is that? Ask yourself, why is that? And, people hear me bash on Trump, but it's not a Republican Democrat thing. I mean, he is who he is. I'm an independent, so you're not going to get a positive statement out of me regarding Republicans or Democrats. But to politicize a global crisis, to finger point, is absolutely the wrong thing to be doing in a crisis. As long as your finger is pointed at someone else, it's never pointed to a solution. And people, people have self-hatred. All of us have things that, mistakes that we've made that we beat up ourselves for, and that when we get tired of beating ourselves up, we kind of pretend that, the remorse isn't there and the guilt isn't there, and we're perfect now, but people take their inner hatred The easiest thing to do with it is turn it on somebody else. The finger pointing, you're wondering, if you're really concerned about a crisis, if you're that concerned about it, you can't be so concerned when you're pointing the finger of blame. Because when you fall into a raging river and somebody accidentally bumps you into that river, you're swallowing water. You're running into rocks. You're being gouged by twigs as you're washing by limbs and branches and trees. You're swallowing water, and you're simply trying not to die. And I am appalled by the complete lack of hand contact control in places where public gather. People don't give a crap. And there's been so much disinformation on this, and so many mixed messages, and so many fishy circumstances. Some people think that this is just the flu. Oh, it's just the flu. And, well, shoot, if 20% of the people think it's just the flu, and that was also echoed by a leader and leadership. It's not just Trump, there's advisors around him. And I am speechless. I am speechless by the contradictions. It's just the flu was the first message we got. And what did we tell you? We told you when the president and the head of the CDC was saying, hey, this is just the flu. I was telling you, no, it's not. There's a patent on this thing, patent pending. And I know, how do you patent a virus? Well, it's for a vaccine. And then you have all these people who are like, well, the death toll's only 3,000 and the flu killed 70,000. So what are you worried about? I mean, that is one of the most ridiculous, nonsensical, completely irrational statements. It absolutely means absolutely nothing until the pandemic is over. And then pull out your scorecard. But just know this. The numbers are wishy-washy, and we all know that. And because of it, people think, what? That it's just the flu. And the people who report on these circumstantial findings, the contradictions, the way they're messing around with the numbers, all of that does not support the notion that this virus doesn't exist. All it does is support a notion that there's an agenda. That's the only conclusion you can draw right off the bat when you start having misinformation, disinformation, or contradictions and mixed messages coming from the people who are supposed to know more than me and you. There's got to be an agenda. What else can there be? And if I can tell you how this thing's going to play out, if I can tell you more about this virus than they tell you, something isn't right. Something's not adding up, and from the start, nothing has added up. And because of it, people draw the conclusion that it's a hoax. And I'm talking to people, I mean, how and why? Well, because I can. I'm in healthcare. So, I mean, I talk to lots of people who have been sick, that before there was even a diagnosis. And I'm interviewing them. And the interviews, pardon me, but we have to do it, we're not using Verizon phones. So because of their association with people who I have a hard time trusting. And so I have to go away from my home. I have to take a computer. Sometimes I rent a hotel room and make a phone call from a non-Verizon phone. And the people will tell you, I've called people off of KimberTouch regarding their orders, and I use a different phone number every time. So it's important that we're doing interviews with people who've been sick, because it's not a hoax, even though they're maybe hyping or exploiting what's going on. And we tried to call out the disinformation. We cannot do it on YouTube. You cannot call out disinformation on YouTube. So, because the disinformation is coming from such a high source. Well, that should scare you. I mean, that should wake you up. And there's no changing what's going to happen. I don't believe that we can organize. I don't believe that you can cast enough blame. I don't think you can do enough fear-mongering to make everybody afraid of what's about to go down. And so basically we have no choice but to take care of our own, take care of ourselves, shore up the loose ends, and quit bad-mouthing the people that are in control, because I don't think that puts you on a favorable list. And take care of you. And that's what being prepared was all about for the last 8 years. And when the 21 shows up in Agenda 201, that's 20 plus 1, Agenda 21, something's going to happen in 2021. And it makes sense to me because I see what the solar system is going to do to us by 2023. And when you're on a raft in the middle of the ocean and you may not be rescued for 14 days, and there's only enough food and water for 3 people, yet there's 12 people clinging to your raft, that's a touchy situation. And I would not want to be on that raft. But when you're in that situation, pointing the finger of blame, how you got in the water, how you became shipwrecked, how you became stranded, is a moot point when you're trying not to die. And basically, you people who think this is just a hoax don't have very much biology behind you. I know you don't, because you wouldn't be saying that. You'd be reading the research that's coming out of all the other countries, not just our, corporatized medical entities that release public information that's not very useful or contradictory or, wholly inadequate, let's put it that way. When that's the case, and you think it's a hoax, there's no way you have any medical background. There's no way. You have no clue what's going on in the hospitals. And, people are really good at taking what happens at one excuse me. People are really good at taking what's happening in one hospital and trying to apply it to all hospitals, and that is not the case. If you have a hospital that's dependent upon Medicaid and Medicare, be careful. You need a hospital that also takes private insurance so that they don't plug you into the system without a firm diagnosis. And that's what was happening at Elmhurst. That was, if you see the movie Coma, watch that movie, and I wouldn't be surprised if they even used Elmhurst Hospital for that movie. I stay away from Elmhurst Hospital in New York, and they should be ashamed of themselves. And you can tell when you listen to the doctors justify their actions. You can tell when they're not being honest with themselves. You can tell just by the tone. You can tell just by what they're saying. They're just purposely ignoring certain key points and certain key principles. When a doctor says, there's no treatment for viruses, there's no treatment for the virus, you can't kill the virus, every nurse should grab that doctor by the lapel, of course using gloves, and quietly look him in the eye and say, then why do they put silver in newborn babies' eyes? Ask him. Ask him why there's a higher success rate in treatment of people who get chloroquine. And the first thing he's going to do is try to make an excuse. And the way the FTC and FDA attacked people that were peddling silver, promoting silver, advertising silver, recommending silver, which is what we recommend. And we don't recommend just silver. You know, if you make silver, you're going to promote silver. But we're promoting three-pronged approach to this coronavirus. Well, this is a don't take any chances kind of protocol. Humic acid, silver, and vitamin C. And then there's the quinine sulfate. You know, you can go buy quinine sulfate in tonic water and make sure that tonic water doesn't have benzene, benzoic acid, or sodium benzoate, which is one of the worst carcinogens on the planet. But it's not so carcinogenic that they can't use it as a preservative, you know. Well, we want you to have food for the next 10 years, even though it causes leukemia. So you can buy quinine in your grocery store. So anybody who tells you how unsafe it is obviously doesn't get it. They don't get how unsafe this virus is. And the people who've had it, and I'm talking to people every day that had this before there even was a test for it. One guy I interviewed, and you'll hear that interview, he says it'll knock you in the dirt. He says, you know, I'm 64 years old. This is the worst thing I ever had. He goes, it was the most bizarre behaving cold I've ever had. It was not normal. It was a whole month. And the coughing was relentless. You couldn't stop the coughing. And one lady had no respiratory symptoms. She had simply cardiac symptoms. This thing targeted her heart. And so that tells me the transmission was not inhaled. That tells me the transmission could have been internal. And this thing targeted her heart, which already had an issue. And they tested her for a dozen different viruses. They said, we know you have a virus. And then they retested her again because they couldn't believe that dozens of viral testing would all turn negative when they know she had a virus, simply because of her antiviral cells were going through the ceiling. and she had symptoms of an infection, including the fever. They kept juggling antibiotics, and they didn't help. So she's lucky to be alive. And basically, they came off a cruise ship, you know. So I've interviewed 3 people that came off cruise ships sick. Also interviewing a person up on the most active super volcano on the planet, Long Valley Mammoth Mountain. They had a huge issue, and mainly people working in bars and restaurant bars were getting sick. So imagine my horror when I go into a restaurant that's supposedly safe, and the lady delivering my food is also handling cash and not washing her hands in between transactions. They don't care. And the one reason they don't care is because, one, it's their livelihood, but number 2, there's no leadership, and and that's intentional. It has to be. So listen here. Hand contact is the #1 form of disease transmission. Hand contact transmission is virtually impossible to stop. Because what happens in hospitals that have, let's say, an intestinal bug going around called C. difficile, causes diarrhea, causes bleeding, is becoming resistant now to the drug of choice, causes dehydration, can kill the elderly, and it's a diarrhea. And it's spread only through hand contact. So if the people who know about hand contact, if the people who are taught about hand contact, if the people who are supposed to be using universal precautions and assume that everything they touch is contaminated, those people are spreading the C. diff or C. difficile to other patients. So, and once you get it on the floor, you can't get rid of it. And it's only spread one way: hand contact. You don't know this. I sent this in a private email to my Patreon subscribers, because I leak a lot of stuff just in short, quick memo-like emails to my Patreon subs, telling them that in one of the hospitals I'm referring to, on their COVID floor, 19 out of 21 staff just tested positive. And they're asymptomatic. So what's going on? What's going on? Hand contact is virtually impossible to control. And the reason is very, very simple. It's impossible to keep from touching your face. It's impossible to sometimes wash your hands good enough when you're in a hurry. It's impossible to control all the contact surfaces unless you make a commitment to control all your contact surfaces. For a brief period, I did some consulting for hospitals on infection control, because they have an infection control department. They have an infection control nurse. Her job, what's her job? To sign off documents that they're doing what they're supposed to be doing. Meanwhile, there's another new diarrhea case on the floor in a patient who was not there for diarrhea. And once you get it, it's virtually impossible to get rid of it until you understand where your modes of transmission are occurring. But I mean, in a hospital that's their COVID floor is full, you have dietary people delivering your tray to your room, and they're not wearing gloves, and they're not wearing masks. It's your food. And this virus likes it when it goes in through the digestive tract. The acid in the stomach will not kill it. And it attaches to the lining of your stomach and your esophagus. And hand contact is the #1 source of transmission. So just think about it. Stop and think the endless. You have staff that are wearing masks, and they touch their masks because it's not their face. They reposition their mask. They pull it down and let their nose hang out so they could get some fresh air. Well, that's the stupidest thing in the world. You know, if you're going to take your mask off, grab a strap and let it hang from one ear. But don't take your nose and sniff the outside of your mask, and that's exactly what you're doing as soon as you pull your mask down below your nose. You're not protecting anything. It's a joke. And the N95s are important, but obviously it's not working. And we knew this in Wuhan. And we knew this in New York when the staff was getting sick. We knew it, that the N95s were not doing it. So then, you know, what does a former infection control consultant do? They start interviewing people. How in the world do you think an anesthesiologist gets, you know, anybody in the OR? That's like your most sterile people. These guys wash their hands longer and better and with more powerful stuff than anybody else in the hospital. They never walk into a surgical room without a mask on. So they're masked, they're gloved, they're washed. And so how does an anesthesiologist get it? And so it's not rocket science that if you have airborne particles, they're usually airborne from cough and sneeze. And if you have a runny nose, yeah, you're as contagious as anything on the planet. When you blow your nose with tissue, you've got it on your hands. This thing goes through the porous tissue paper like water through a tunnel. And I'm disgusted. I'm disgusted by the complete lack of consideration of hand contact surfaces. When I go in and I just observe a grocery store, even in a low-risk area, I'll watch 100 people walk up to the milk refrigerator or the egg refrigerator, and the first thing they do is grab the handle that has been grabbed by 100 other people. They don't care. And it's the reason they don't care is nobody's making them care. And I'll tell you right now, if you go to any of those refrigerators, refreezers in the grocery store, grab the edge of the door. Don't grab the handle. Reach up, grab the top, reach down, grab the side, dig your finger in that little crevice where the magnet is, and pull the door open. But don't grab the handle. And how nice that nobody's telling you that little tidbit. They did a study. $20 bills are as germy as a doorknob in McDonald's in New York City. There you go. So indirect and direct contact is the #1 form of disease transmission on the planet. Next time you grab a doorknob, ask yourself how many people have grabbed that doorknob before you.